Hi, this is Dr. Rosenberger from Appalachian Spring Dermatology, and today we're talking a little bit about Kybella. We previously have done some videos looking at using Kybella for under chin fat and for sculpting the jawline. And today we're going to talk a little bit about using Kybella to treat small areas of unwanted fat. So we've done this a few times in the office, just because it's not something people ask for a lot, but we have done it for small areas, usually about the size of an egg, as well as for some lipomas. Usually lipomas are larger lipomas where people want to avoid a large surgical scar, and we've really seen some great results with it. As with everything, we usually start small. We could always do it, wait. Again, with most fat reducing procedures, you're going to need to wait at least 8 to 12 weeks to see the full effect. So we're going to wait 8 to 12 weeks, and then if it needs a little bit more, we can always add a little bit more. We don't want to leave the area indented. So it is something we do progressively over time. So areas where this can work well for, small areas of little fat that are around the underarm, right in the back with some little bit of bra fat. We've used it on the belly for somebody who, after we cool sculpted, there was just one tiny little area that they didn't like, as well as a few other things. So we'll demonstrate how to do that today and show you sort of areas where that can work well. With Kybella, it actually comes like this. This is the box, and it actually normally has 4 vials in it. We've used some out of there, and this is the size of the vial, and so it actually comes already made up. So just to use it, we just flip it open, and then usually we're going to use a 3cc syringe to draw it up, and use a big needle to get it out of there and a little needle when we inject it. So this is pretty simple. We just want to get it out of the vial, and then we're going to switch to a much nicer needle for that. So there's very little prep to do with Kybella. It's already ready to go. It's nice because it's stored at room temperature, so it's not something that we need to make up ahead of time or do anything with ahead of time. When we do things like Kybella, we usually do put a little bit of topical numbing medicine on. Sorry, I hooked the wrong way. This is lidocaine ointment, and a lot of times we will use an ice pack. The areas of fat usually are very, it's very obvious that it's responded well. When we do Kybella under the chin, a lot of times we will measure with these little old-fashioned fat calipers, and sometimes we'll do that on other pockets of fat as well. But it is usually quite obvious when we're doing these little pockets of fat, so there's no need for the fat calipers. Under the chin, I like to use the fat calipers because a lot of times, depending on the person's jawline, there's a huge reduction in fat, but not always. Sort of the slope of their jawline doesn't always change. So that's one thing I like to do separate there. So we'll change positions and we'll show you injecting Kybella in one of these small pockets of fat.
Call for an appointment today and learn more by going to our website at wvderm.com.